be able to pick up some very critical things. So, for example, foreign body in the nose and epistaxis, what's the relationship and how are you able to pick it up in a board exam? When are you going to consider foreign body in the nose as a key cause of epistaxis? Look out for these two things. Epistaxis with purulent discharge. If you are presented with a child who has epistaxis and you're also told that along the epistaxis from one nose, one nostril, there's also purulent discharge, start thinking about foreign body as a possible cause. And most of the time, that foreign body has been there for quite some time. Now, epistaxis with purulent discharge, what is another differential apart from foreign body? Sinusitis. Sinusitis. So, two things. If I have epistaxis in a child with purulent nasal discharge from one nostril, I'm going to think about foreign body. Even in a child with, purulent discharge from one nostril, if foreign body has been ruled out, sinusitis will be thought about. If I have an adult who has epistaxis from one nostril or both and has purulent discharge alongside it, I'm going to think more of sinusitis before foreign body because adults tend not to put things in their nostrils unless that patient has some mental derangement, right? So that's a clue that I want you to pick up. Number two, second clue, if you have a patient who is presenting with recurrent epistaxis in your medical board exam, that's why I put this magnifying glass. It's like, you're looking for clues, right? Think about a bleeding disorder, recurrent epistaxis. The patient is not on any medication, no trauma, nothing. Think about a bleeding disorder, like von Willebrand's disease, like hemophilia, all those ones we mentioned, right? I'm just giving you clues so that you can be able to tell things apart so far as your board exam is concerned. Now, how to pick up carotid artery aneurysm as a cause of epistaxis. Carotid artery aneurysm as a cause of epistaxis. Look for a patient whom you've been told in your board that has a prior history of head and neck surgery. And after the head and neck surgery, that patient started developing epistaxis. That should draw attention to carotid artery aneurysm. Most of the time, carotid artery aneurysm causing epistaxis, that epistaxis will be posterior epistaxis. And I have a question, back to what we've studied already. Will it be serious bleeding or it will be minor bleeding?
Serious bleeding.
Serious bleeding. Beautiful. Serious bleeding. Beautiful. Beautiful. So, doctors, are you seeing the way we are building the links? Another clue. What is your next best step? Okay. After a posterior nasal bleed has been well controlled and the patient is hemodynamically stable.
ENT referral?
ENT referral. Yeah.
Good. ENT referral for a thorough ear, nose, and throat evaluation. Remember, yes. I'm talking about posterior nasal bleed.
Yes.
Right? Posterior nasal bleed. After a posterior nasal bleed has been corrected, what is your next best step? Now the patient's blood pressure is fine, patient is breathing fine, the patient's oxygen saturation is fine, the patient's pulse is fine. What will you do? Please make sure you get an ENT specialist involved so that this patient's ear, nose, and throat can be assessed. Okay? Dr. Margaret, please, your question.
Is there like a difference with how the blood flows for a patient with an anterior bleed as opposed to a posterior bleed?
Not really. In fact, the literature commented on it. Not really. However, you realize that if the boards want you to really know that there's a posterior bleed, they will present a patient who is probably hemodynamically unstable. The bleeding is not subsiding despite pinching and applying oxymetazoline. Like, it would be a very severe scenario in a patient with a posterior bleed. Yeah. The next clue. Remember, I asked this question and you guys even gave it to me. Who is at highest risk of nasopharyngeal cancers? The answer is Chinese or Southeast Asian heritage. Okay, who are Chinese or who have a Southeastern Asian heritage? So I'm sure those who thought, oh, if we're going to just talk about epistaxis, let me just, log off and think about myself because epistaxis, all you need to do is to let the patient sit and bite or breathe through their mouth and clench their nose. Now you see all these things which are coming out of the lecture. right? And that is one thing I like about, the Canadian way of learning. You pick one objective, and then as you go into it, it leads you to touch on various things, right? So that you can build your knowledge base very, very well.